Hi, my name is Kim Griffiths. I'm a student physical therapist assistant at Just State, and today I'll be talking about infection control in the ICU. Hospital-acquired infections occur in roughly 15% of hospitalized patients, according to the World Health Organization. Hospital waste is a potential source of infectious pathogens, with up to 25% of hospital waste being deemed hazardous. Infection control methods include hand washing, proper disposal of hazardous waste, use of personal protective equipment, surface cleaning, which would include um, adequate disinfection of surfaces, especially surfaces where a lot of hands come into contact with it. Other good methods include following standard precautions as well as following airborne contact and droplet precautions. This would include if you know that a patient has an infectious disease that can be transmitted um, through the air, through contact, through the spread of droplets, you just want to keep those patients isolated and in their own room. Um, where physical therapy and physical therapist assistants come into play with this is if you know that a patient has an infectious disease that can be transmitted either through air, through contact, or through droplets, you want to avoid taking them to the therapy gym or taking them to other areas of the hospital. It's better to treat these patients in isolation in their own room so that you can decrease the chances of spreading those infectious diseases that they may have. Hands are the most common transmitter of infectious organisms, and hand hygiene and hand washing is very important. You want to wash your hands before and after touching a patient or after touching the patient's surroundings. You especially want to wash your hands after exposure to any kind of bodily fluid, especially if you know that this patient has an infectious disease. Standard precautions would just be to treat everything as if it um, or treat every bodily fluid as if it has the potential to be an infectious disease or have infectious germs. Um, proper proper disposal of materials that have come into contact with bodily fluids is another good way to decrease the chances of spreading infection. Using bins like the ones pictured here are a good way to decrease the spread of infection. Properly disposing of needles, catheters, IV lines, anything of that sort, as well as properly disposing of soiled linens, towels, clothing that the patient might have been wearing, especially anything that came into contact with bodily fluid from that patient. You want to properly dispose of it in a bin like the one pictured here. Personal protective equipment includes gloves, gowns, and mask and eye protection, as well as a face shield. The gowns are a good tool to utilize when working with a patient. So you prevent those infectious germs from getting on your clothing, which you could then spread to another patient. As physical therapist assistants, we're in contact with patients all day, every day. Um, so when working with one patient that you know has an infectious disease, you don't want to then spread that to another patient you work with later on. So a gown is a good way to decrease the chances of those happening. Gloves and then the mask, the eye protection, and the face shields protect you as a physical therapist assistant yourself from getting those infectious diseases, which you could then spread to another patient that you work with later on. So, as well as protecting your other patients, this also protects you. Uh, Main hospital acquired infections are caused by catheter associated urinary tract infections, surgical site infections, bloodstream infections that can come from the use of a catheter, as well as ventilator associated pneumonia. Here on this next slide are just some pictures of common devices used in the ICU that can, when used, increase the chances of a patient acquiring any kind of infectious disease. On the left there is the ventilator, there in the middle is an IV line and catheter, and then here on the right is a urinary catheter. Any of these three devices can increase the chances of a patient receiving an infectious disease, especially if they are in the hospital for a longer amount of time. That is all for my presentation today, and I look forward to your questions or comments. Thank you.